Good morning. It says that I'm live, but I am supposed to be live with Dr. Kiltz. So I hope he's going to join the live stream. Until then, in case I am live and other people are here with me, good morning, everyone. Happy Halloween and happy Sunday morning. This is always my favorite time of the week, other than Tuesdays when I get to be at CNY Fertility. Sunday morning is a special time, right? It's the time we get to recharge, renew, rest, whatever it is that's going to reboot your battery. So I'll just introduce myself. My name is Jennifer Waters. I am one of the healing arts practitioners. I'm an acupuncturist and light therapist. I've known Dr. Kiltz for a long time. It's always been a pleasure working with him. It's because of him that I got involved with fertility, believe it or not. And I remember the day that he asked me, gosh, almost probably 15, very funny, Erin. 15 years ago when he said, why fertility? Why do we want to get involved with fertility? Thank you. It's an honor to serve. And I said, fertility is everything, right? It is our mind. It is our physical body. It is our spirit, which is the energetic aspect of our emotions. It's everything. So there's Dr. Kiltz.
How you doing?
Good morning.
Good morning. Are you on your MacBook?
Yes.
Take a piece of tissue and just clean over the see the cab. Sometimes the cab, it might be not just right over the camera.
Okay. How's that? Ooh, that's
much. Is that been like
brighter?
Right. All right. Let me say goodbye to my boys before we go live. Give me 1 second. All right.
Okay, I'm just going to keep rambling on. So, yeah, thank you. Gosh, this is what I love about Dr. Kiltz. You always get little gems of tips for how to improve. So, unless somebody gives you feedback, how would you ever know that you need to clean your camera? There's dust everywhere. I'd like to introduce Zelda today. Zelda has moved in with me a couple years ago. I believe that she is from Skinny Atlas. And I'm going to tell you a short little story about her because it's relevant to today. I was at a silent auction and everybody told me, well, you're not going to get anything at this auction because 10 minutes before the auction closes, everyone goes in and just puts the number that's going to get them what they want, which is everything there. And so I said, oh, okay, all right, fine. It is what it is, but I'm going to bid on her. And I bid, it was less than a third of her retail value. And I did my number. I went home. I never thought about Zelda again. And then I got a call Monday morning and they said, come pick up your the goods that you got at the silent auction. And I said, really? Wow. I wonder what I actually got. And there she was in this big box. And I'm telling you that because I think it's important that we focus on what we want. There's always going to be obstacles that are presented. And that's all they are. They're obstacles created by other people. We don't know what the outcome is going to be for anything that we do. Set your intention, which is slightly different from motivation. Set your motivation to be positive. Focus on what you want. And we just don't know what the outcomes will be. So this is Zelda's last day of being out of the box. She is the Halloween witch. And it's nice to just create a little bit of magic in the atmosphere. They say with Halloween, this time the veil is thinner between us and the invisible world, the invisible realm, that which we do not see, but a lot of people feel. We know it to be true, even though it's hard to prove. And that's the interesting thing, right, about all of this is We have science, we have regenerative science, we have anecdotal studies, we have all of this stuff that's influencing our beliefs and the way we're thinking about things. And the truth is, it's very hard to nail down anything. I do want to say one thing, which is when I see you on Tuesdays, if I have the opportunity of working with you on a Tuesday, I ask everybody the same question. Where are you from? Where are you staying? I'm always curious. I like to give feedback so I can provide folks with additional places to stay while they're here. What have you been diagnosed with, fertility-wise? And then I always ask, what do you think is the cause of that? Because I'm very curious what people believe is causing their problems. And in the beginning, when I started my clinical practice over 20 years ago, I would ask people the same question. So what do you think is causing your migraines, your IBS, or whatever? And hello.
Hi.
Dr. Kiltz, welcome back.
Okay, are you on? Are you live?
I think so. Yeah, I've been rambling on, and it says live
Oh.
on my screen.
So I'm on your live. You're supposed to be on my live.
I followed the link sent by Jake.
Well, okay, let me see. Okay, whatever it is. All right. So you're live, I'm assuming. Let's see here. Sorry about that. I went for a little break.
You deserve a break.
I took a little break. Sorry about that.
No, that's all right. I've been rambling on about things that I like to talk about.
Well, let's see. Jennifer Waters, welcome. I'm so excited to have you on our live today. And we're talking about everything Chinese medicine, plus more, because you've really rocked the world. And I've known Jennifer for 20 years-ish. She's just been, I'm going to use a little bit of a rebel rouser in really adding to the standard TCM world, light therapy, pressure points, laser stuff. And now you've been talking about this photo biomodulation, which I'm excited to talk more about for everyone.
Right.
And so maybe Jennifer, you can just tell us briefly about yourself, and we can kind of go from there.
Okay. All right. Yes. Well, I always say that I rebelled into health. And in our teenage years, most teenagers rebel into something. And I rebelled into health. And I was surrounded by a lot of sickness and disease. And I decided at a very young age, I did not want that. I wanted to be healthy. I didn't want to go down this path that led to a lot of problems. So I got involved with health and healing really in the 80s. And it started with food, with diet. It was macrobiotics back in 1984 or 5. When I lived in Boulder, Colorado, I used to go into Boulder and take classes in macrobiotic cooking. And they were very into how you ate and chewing your food, breaking it down so that it turned into sugar before you swallowed it. And we were all instructed to chew our food 100 times per bite before you swallowed. And so I thought, I was really impressed with all of that. Eventually, it became a little bit too controlling for me. You know, they were kind of a little obsessive about how many times we were chewing, you know. So I didn't really.
Yes. My mother would tell me, chew your food, chew your food. And I'm like, I think we're just like speed chewers and eaters, and get it down fast. And But you mentioned that one little thing about breaking it down to simplify it so it's more easily digested. That's basically it?
Yeah, definitely. And when it converts to sugar in the mouth before you swallow, this is what I understand anyways, then your sugar cravings are really minimized. So you really can eliminate craving sugar by chewing your food more.
By the way, Instagram, you're going to listen to Jennifer Waters, but if you want to go over to our CNY Fertility Facebook and YouTube and Dr. Kiltz's Facebook and YouTube channels, you can actually see us both in this interaction. So she's much better looking than I am for sure.
Not really.
So,
No, Zelda's the one.
are-
Zelda's the best looking.
Oh, well, it's a perfect day for witches, right? It's Hallows Eve, right?
Yeah.
And so, how did you get into acupuncture in the first place? And about traditional Chinese medicine? Maybe you could tell us a little bit about that part of it.
So that was really through philosophy. So I've always been involved and interested in philosophy, understanding the nature of reality, the mind. Why are we here? What are we doing? What is the point of all of this? And so it was through macrobiotics, because the basis of macrobiotic is yin yang theory. So this is Chinese medical theory as it applies to food. And so I started reading on it, the I Ching, the Tao Te Ching, all of that. I found it fascinating. And I decided early on, after my 4 years as an undergraduate, where I was lucky enough to spend a year in East Africa, and I studied traditional practices of healing in Kenya and Ethiopia, Tanzania. And then I came back to Syracuse. My mother was dying. My mother unfortunately passed away at a very young age. She was 41 years old.
Wow.
From cancer. And she taught me a lot about what does not work. What do you not want to do? And this leads me to a question I want to ask you later on about, can we extend our life? So then I decided that, and I did spend a year in China. I went to China. I felt very at home in China. I learned the language. I studied with incredible teachers. It was a wonderful opportunity. And I decided I wanted to get involved with a career that I would never be bored with, that really helped people, that wasn't all about paperwork, and that allowed me to do it anywhere. So I chose well. I think I got lucky because I've never been bored, and it really does help people, and I don't have to do too much paperwork.
Yes, we always have to document something in all of this, for sure.
That's right. But it was really a foundation, a place to begin. It was also my excuse to move to Honolulu, which is where I went to school. I was used to move to Hawaii, and it's a wonderful place to be. And I wanted to go to a very Chinese school because that was important to me, the tradition, the lineage. And I had a wonderful experience, but that was really the beginning. And so, I'm always looking for ways to help people in the shortest amount of time that's very effective and that it's easy. And there's a lot of extremely complicated systems out there, and maybe they work, maybe they don't, I don't know. But what I like to do is focus on things that possibly bypass the gut, that go right into our cellular health, that really work in a short amount of time. Most of the people that we're seeing, they don't want to take 6 years to improve their health. They want to take 30 days or a week or whatever. So that's kind of how I got involved with light.
How does between light and needles and acupuncture, are there mechanisms of healing different?
Well, yes and no. I mean, all of it is about bringing the body back to balance, right? Because we're designed to heal. We're self-healing mechanisms. And if we're not, what is causing that? What is impeding that? And so whether you're using acupuncture or magnets or breath work or meditation, it's all doing the same stuff. And so I always tell folks, do what you're drawn to. Not everybody loves needles. If you're scared of needles, acupuncture might not be the thing for you, which is, again, how I ended up adding light, because we can influence the energy of the body with a lot of ways. Light is just a very effective way to do it. So, yeah.
And sunlight is our best mechanism, I'm assuming, and all of our artificial lights are kind of the wrong lights, probably. We're not spending as much time outdoors, and we're certainly fully clothed, but our skin types may be different than how we used to be. But but the mechanisms of the light therapy, maybe you can catch on that a little bit.
Yeah. So originally, my first introduction to light of photobiomodulation, light stimulating your biology, was LED. So I have it here. I can show everybody in a minute. A lot of folks have seen it, but this is a pad-based system where you plug it in, you set different settings, and you're actually donating energy to the body on a cellular level. What happens is the body releases nitric oxide, the miracle molecule, from the red blood and endothelial cells. And that's what acts as a vasodilator, as a neurotransmitter, as an antibacterial, possibly antiviral. It starts cleaning up the terrain, I call it. We need to clean up the terrain of the body, of the gut. And so light does that very quickly through this release of nitric oxide. I had a labral tear in my hip. I was told I had two options. I could shave it or sew it. And I did a lot of things to prevent that: acupuncture, massage, energy work. Everything helped a little bit, but I was terrified. I was in agony. And I gave up yoga. I gave up hiking. I gave up everything because I didn't want to go back to that extreme pain. And then I was at a friend's place and she said, well, let's try this light therapy. I said, fine, whatever. I put the pads on. In one 20-minute session, all the pain was gone. And so I was like, wow, this is really interesting. I cannot believe how much better I feel after 20 minutes. And then about 4 days later, the pain started returning in a milder way, but it came back. I went back for one more session. I did the light therapy and boom, I knew the tear was repaired. All the pain was gone.
Wow.
All the fear was gone. I got back into yoga, into hiking. It actually induced the collagen to repair that labral tear. So I said, okay, well, whatever this is, I'm going to buy one of these machines. So I bought one. That's how I got involved. And I started using it at everyone. And I use it all the time, every day in the clinic. Everybody receives light. So fast forward to now, I created this program, Optimize Your Egg Quality with Phototherapy, because since I've been involved, thanks to you, in the fertility world for so long, I've decided, what do I really feel is the most important thing to help your patients? And I think it comes down to egg quality for me personally. And I like focusing on that because the truth is we don't know about quantity, right? I think it's an interesting question. Can we extend our life? And I mean, I've been told, no, you cannot. When it's your time, it's your time. And do we want to live to be 110 if you're full of pain and your brain is deteriorating? And maybe we don't want to live that long. Maybe we want to have a quality experience. Maybe we want to increase the life that we have in terms of quality, not quantity. So anyways, so egg quality really excites me for that because we can remove the things that are causing a decline and increase the things that are causing, better quality. So the Optimizing Egg Quality program is using a newer kind of phototherapy. It's still photobiomodulation, but instead of a pad-based system, we have these little patches that go on the body and use the heat or light of your body to create an endogenous experience.
What do you mean the light of my body?
So heat is light. What they're saying, so it would be in the near infrared spectrum. So the invisible spectrum, because we see red, we see blue, we see green, but we don't see the near infrared, although you can with your cell phone camera.
And there are devices that pick that up. We've all seen infrared light, and also picking up your aura.
Yes,
which is a
yes. Yes.
Okay.
Yes.
All right.
So these are heat activated. So using the heat of your body, which then activates a certain biochemical response depending on the patch. So like this patch in particular, this is the stem cell patch, X39. So what they say is that when you apply this, this is going to increase the GHK copper peptide. I know there's a lot of talk now about copper and elevating copper, and that is how one of the ways that stem cells are then produced.
Mm-hmm.
And as we know, stem cells repair damaged cells. Stem cells are recruited by the body wherever there's pain and inflammation. So it makes sense that they would be recruited by your ovaries if that's where they're needed to go. So it's kind of like there's 10 different kinds of patches. We can really customize exactly what you need. And this goes back to causation. And I do like to ask everybody what their diagnosis is. And especially from a Chinese medicine point of view, I ask everybody, and I'm surprised at how many people show up in the clinic and they don't have a diagnosis from the acupuncturist that they're working with in whatever part of the world. And I think it's important because we want to help you figure out what is your root initiator, what is your root imbalance, your weakness. Because the theory is if we treat the root, then the branches are going to heal. And so I do want people to kind of look within and try to determine the one thing that could be driving their imbalance. And then we can customize a program, protocol, whether it's patching or whatever, to help correct that.
One of the things I found about traditional Chinese medicine and Eastern medicine is there's the whole body mind connection. Was so critical in all of this. And I've learned so much from you over the years and talking about yoga and dietary changes and a regular practice of these healing modalities, which help keep our energy flowing in the right direction is such a critical and important part to this. I mean, obviously people come to the doctor with aches and pains or dysfunctional organ systems, or in our case, as a fertility specialist, because either they're not getting pregnant or they're miscarrying, or something related to bad sperm, bad eggs, bad embryos, or bad implantation. And we don't always know the answer to all of that.
Mm-hmm.
How do you approach? I mean, obviously, we have the female side that we really kind of focus on the most, and neglect the guy side. And we probably should focus a little bit more on that, in my opinion. But much of what we do because of pre-IVF, pre-transfers, pre-IUI, how do you approach, or what type of questions do you have for the woman who's experienced her infertility situation?
It's a really good point. I truly believe, and this is after being in clinical practice for over 20 years, that everything begins and ends in the emotional realm. And we minimize it because it's almost too simple. I think we overlook the simple all the time. And you absolutely have to pay attention to how you're feeling. Because it is driving the train. And I think now we know more about hypnosis. Hypnosis is connecting us to that which we're not thinking, but it's still influencing everything that we do in our emotional realm. And it's absolutely important. Before you came on during your break, I was telling the story of how Zelda ended up moving in with me and how I got her from a silent auction. And I believe she came from Skinny Atlas, Patience Brewster. And everybody told me, oh, you're not going to get anything at this auction because everybody goes in minutes before and they bid, they get everything they want. And so you won't get it. And I said, oh, okay, whatever. So I put on my amount that I was willing to, take her home for, and never thought about it again. And then I got a call the next week and they said, come pick her up.
Zelda's yours.
Right. And so it's a good reminder that we just don't know what the outcomes are going to be, but you have to set your motivation and your intention for something positive, neutral, or above. But sinking down into the negative realm and having these negative emotions is not going to help you. And so the beauty of Chinese medicine is that it really does focus on both. If we diagnose you with, let's say, liver blood stasis, that's most connected to anger, to frustration, to rage. And so we can focus on getting your liver functioning, optimally. But if you don't address the emotional part, it's never going to last. So you could say, well, just work on the emotional part, get the rage out, and then boom, suddenly your liver's functioning better. So you can really, there's multiple ways in and many ways to return.
So that the emotions of fear, anger, worry, regret, judgment, joy, love, kindness, faith, positivity, negativity are all energy releasing particles that affect every cellular nook and cranny of our body and beyond. And so that vibrational energy, that light energy, that molecular chemical energy, whatever it is, and this is the mystery to understand it all, because we're pretty much blind in this world, but it is such an important part. And one of the things about your profession isn't just come on in, put needles in, and walk out. There's a connection and conversation, a sharing of ideas that are really important to understand what's going on with the person in front of you, and listening and learning from them at the same time. And I think that's one of the challenges in Western medicine. We've lost that connection that was in the traditional old doctor-patient relationship, but in the modern world of let's make more money, see more people, get more drugs passed around, we're missing the really most important thing of who's the person in front of me, what are they suffering from, what are the things that we can connect with and give them advice, ideas, protocols, procedures, treatments that they could take home with themselves. I'm imagining that's really the most important part. And that's part why this is so important for you and I, is we're sharing ideas now with hundred thousands potentially over the weeks or years that people are going to watch these things. And there's so much out there on YouTube and Instagram and Facebook and things like that you can now learn without ever going to a practitioner's now, right?
I know. Yeah, the zooming in. I mean, there's pros and cons, exactly. Yeah, it's amazing. It is the age of information. There's a lot that we can benefit and share. And I really do like the idea. We have to customize it because some things are generic and it can be one size fits all, but you're absolutely right. We really have to tune into the person in front of us and figure out where is their blockage, what is going on, how can we best help the person to remove whatever the obstacles are. I'm a huge fan of Bruce Lipton, The Biology of Belief, and the cellular biologist. He's been saying this for a long time. It's not the nucleus of the cell that's driving how the cell functions. It's the membrane, right? And that should be the good news, because that is talking about the environment and that we can influence the environment with everything that we're doing, thinking, breathing, feeling, and that will definitely affect outcomes.
What do you mean by the membrane? Which
the outer edge, the membrane of the cell versus the nucleus. That was his big breakthrough in his book, The Biology of Belief.
Yeah, Bruce Lipton's quite amazing. I recommend everyone listen, watch, and read his stuff for sure. And so a patient comes to you and talks about her need to become pregnant, have a baby. How do you approach that in that moment? I'm coming for acupuncture, or I'm coming for light therapy, or I'm coming for photomodulation. Is it the blanket is individualized in the sense of, well, I think you're going to need this. I'm going to give you this treatment now and send you home with these sort of things. Which is your approach as you're expertise?
It's all of the above. So now a lot of us have virtual clinics, so if I'm seeing you in person, that is going to be one approach. I use what's called the AccuGraph, which is meridian testing software in the clinic, which I love. It gives you a visual representation of the energy in your body and how well it's functioning, where the imbalances are. And then it also gives us a baseline. If I have the opportunity to see you a couple times in a row, we're going to see where the patterns are. Where are you the most stuck? And then we can create a protocol based on that, whether it's diet, targeted supplements, phototherapy, whatever. If I'm seeing you virtually, I really do rely on the tongue diagnosis. This is one of the ways we diagnose in traditional Chinese medicine. The tongue is, yeah, we look at size, color, shape, texture, coating, and that gives us a picture of what's going on inside you, really with your digestion. And so, and also the questionnaire, coming up with the right questions. I love 5-element theory. There is a whole lineage of 5-element endocrinology, and it's one of the interests that I have right now. And this is why I was talking earlier about your root initiator. And this is part of the 5-element theory. So we figure out, what is your imbalance? Is it the wood, which is liver? Is it the water, which is kidney? And then we create a protocol based on the reality of your situation. Some women only have a couple weeks. So that's going to be a different protocol that I'm going to take the next year.
So what's the 5-element theory?
Wood, fire, earth, metal, water. So each season, like now we're in the season of fall, which is lung, large intestine. So a lot of people are coming in with upper respiratory issues. And this is indicative of the season that we're in. So we know that this metal element is weak for you if you're having issues now. And so we can correct that. The beauty of the 5-element theory is that everything is interconnected. Wood supports fire, fire supports earth. So we see nothing is in isolation. It's all interdependent. But we can determine your root initiator and then help you prepare. If we know fall is your season, we're going to start preparing in late summer or summer so that you don't get weak during this time. And we can do that emotionally, diet, targeted supplements. Yeah.
And so once you've sort of gone over that, and so nowadays it's virtual.
Yeah.
And obviously someone coming in for a transfer, an IUI, getting pre and post acupuncture is one thing, but you're really here to take care of the whole process and give a plan. Tell me a little bit of how you would approach that, either with the dietary recommendations or the photo biomodulation.
Yeah. So and I have to say, when we first started telehealth Zooming, it was a little bit weird, because we all get stuck in our ways, and so I had only done this for 20 whatever years. And then suddenly I'm Zooming with people and it was weird. Now I have to say, I really like it. I really enjoy it. People feel comfortable in their own home. We can talk to people all over the world. It really opens things up. It makes it easier, takes out the stress of having to travel and getting to these appointments and driving hours. So I'm so happy. I mean, this is certainly the upside of what's happening. So, yeah, I always take into consideration how much time, how much money, how much energy, where are you at right now, and maximize what we can do within that. If you tell me you have a $300 budget and you've got 30 days, what can we do during this time? I'm going to give you everything we absolutely can do during this 30 days. And so I love your most recent book that came out, the keto diet. I really like that there's vegan options in there. It's not one size fits all. There's a lot of room for adapting. Yes, that's awesome. And so I do recommend people rely on that. It is the best anti-inflammatory diet out there. You get results in a short amount of time. and I hear it over and over and over in the clinic. So I recommend that. And then I put together a patching protocol. Everyone benefits from stem cell production. So that if that's all you can do, let's increase your stem cells, because the science behind this is fascinating. For people are sleeping better, they're getting more energy. And let's face it, it takes a lot of energy to ovulate, to create a baby, to maintain a baby. You need energy at the cellular level. And so whatever we can do to increase your energy, that's what I'm focused on.
We use a lot of drugs in modern medicine that help with these things. We do know that. Anti-inflammatories, acupuncture, light therapy, and photo biomodulation. What are these discs called again?
The patches, Lifewave.
Lightwave discs or patches?
Patches.
Patches. Okay. Yeah, and how are they used? Where are they put? How long do they stay where they're at?
They are actually, you can put them on anywhere in the body. Okay. But primarily we recommend certain acupuncture points. So we can get very specific. So the guide that I created, basically all the points are in your lower abdomen. So we use certain patches directly over the ovaries, whether or not we want to increase your energy or decrease. If you have PCOS, we want to do more of a sedating protocol.
Cooling. That's the ice.
It's called Icewave. It's not a great name, but they have to use names, So it's not like menthol where it's going to be cooling in your body. It's more sedating. It's more taking out the excess, taking down the inflammation, versus the energy enhancer patches, which is for women that are cold all the time. They're tired. They have, they need more energy. So, and then after that, we choose patches based on your 5-element diagnosis. What's going on with you? Do you have more inflammation, or do you have more digestion problems, hormone imbalance, insomnia? And this again is the beauty of Chinese medicine. Traditionally, there was no blood work, right? We based everything on your symptoms. How are you feeling? How are you sleeping? Are you eliminating? We didn't have to look at blood work. And it's really one of the questions I want to ask you, because women get so committed to the numbers in the blood work, and I just don't know how reliable it is.
Well, so looking for evidence of inflammation is really it, and cortisol levels elevated may be helpful. C-reactive protein may be helpful. Looking at
FSH and AMH.
Now, I think a low AMH or even a high AMH are both indicative of inflammation. And FSH and estradiol levels are also, so an elevated FSH, you usually measure day 3 with a low estradiol. If you have a high FSH and a higher estrogen level, that may also be something going on. So there's just so many variables in these numbers. But I would say a C-reactive protein that's elevated in ANA. This is again where thyroid problems, I think, are all indicative of inflammation. It's just different organ systems are going to show up in different people at different times for reasons we don't understand.
Yeah.
You're infertile, you're inflamed. AMH levels are lower, certainly less than 1, might even be 1.5. We're always looking for a number that correlates with your age, and I don't think it's very good. We're not very good at that process yet, personally.
Mm-hmm.
If you're infertile, you've got inflammation, that may be all. Now we're looking for, well, is your AMH high and it's more metabolic, prediabetes, PCOS-like, or is it low and it's more diminished ovarian function, ovarian inflammation of a different sort that's damaged the primary oocytes and reduced those tremendously? The PCOS person has dysfunctional follicles that don't release eggs naturally and normally. but
Right.
they also tend to have some bad eggs, where the DORs or they're going to have fewer follicles, a few cysts, and they're also dysfunctional eggs. But some of them may have good eggs and just have fewer follicles or eggs in the resting stage in the ovary. So
Mm-hmm.
I don't think we know that exactly. Looking at liver functions,
Mm-hmm.
elevated LFTs, AST, ALT could indicate inflammation of the liver.
Mm-hmm.
Hypertension is indicative of vascular inflammation.
Right.
Those with elevated creatinines may be some renal inflammation.
Mm-hmm. Mm-hmm.
Low sperm morphology, testicular inflammation.
Mm-hmm.
Red blood cells in the urine, even microscopic, is another indication of inflammation in the renal system, which I think renal vascular system. But you don't have inflammation in any single area in general. It's usually everywhere in some way or another. And that's why a global approach is so important. And that's the thing. But which I think we like evidence. And if my AMH is going up, or my ANA or lupus or C-reactive proteins are going down, or hemoglobin A1C is another one that's very good. If my hemoglobin A1C is less than 5.5, and Dr. Ken Berry talks about the hemoglobin A1C a lot, and probably less than 5 is a good number. Fasting insulin levels, and I don't know the exact number of fasting glucose levels, or another thing that can be helpful in this. Oh, and of course, white blood cells. If your white blood cell levels are elevated, or your platelets are elevated, that's another indication of inflammation. They're easy tests to get that may, but if they're normal, then the struggle is, well, I must not have inflammation, but that is not necessarily true.
Right. Exactly. And, before all of these tests, like I said, we relied on your symptoms. And I don't want to oversimplify things to say if you feel good, you are good. But I'm really surprised at how many couples are unwilling to rely on themselves and their own feelings versus blood work. Well, I feel pretty good today. And then they see their lab results, and then it may be indicative of something else, and suddenly they feel bad.
My friend Jeremy sent me his blood work today, and it was basically, it had some numbers that were a little questionable. It's like cholesterol. Everyone's getting a cholesterol level. The doctors want to just throw drugs at them.
I know.
Rather than it's a moment in time that, if I draw it 20 times over the next week or month, it's going to show lots of different things.
Yes.
But, and you asked a little bit about longevity, and we're all going to die when we die. How long we're meant to live, I don't know if that's a fixed number, or I say it's quite variable personally. I think our lifestyle, our mental and physical environment is critical. Who are you hanging out with? What are the things you're thinking about? What are you watching and reading? And that's why I think it's critical to plop yourself right in the bath of positivity. And Bruce Lipton and The Secret and all these things. I read these ancient texts every single day, which is just like an amazing thing that I'm learning. And yoga, massage, acupuncture, tai chi. I get on my bike in the morning and go for a nice easy ride while I'm watching or listening to you or
at 3 a.m.
At 3 to 4 a.m. And because I go to bed at 8 o'clock.
I know. Yeah, that's what I like too.
You got to get up early, go to bed early.
Yeah.
I take 1 to 3 naps every single day.
Oh, good. Yeah.
And napping is so important. Like
It is. Yeah.
10,000 years ago, like it's like I can't, like I didn't say I got to get to the office or I got to drive my car.
No.
Like if you're out on a hunt, guess what?
Yeah.
Get under a tree and take a nap.
I know. It's that simple. I know, but people feel guilty. Like, where does all this guilt come from? Like,
We have been ill-trained. And a little bit is our domestication. We've been domesticated, right? We've been captured and given a story, a brainwashing story of how we need to be,
right.
rather than stepping back and learning how to be me
Mm-hmm.
and accept me and love me and like me.
Mm-hmm.
And if you do or don't, it doesn't matter.
Mm-hmm.
We're all here to love me
Mm-hmm.
again.
Mm-hmm.
But our real most important thing is to emulate love in all the environments we live in.
Mm-hmm.
Because the more we flood the universe with love and kindness and gratitude.
Oh, definitely.
Because we're all going to die, and some disease has got to hit us, right? You know, it's going to die of something, right?
Time will be up eventually. Yeah.
So ill health is ill thinking about how I'm feeling or what I'm seeing, when in fact, whatever you're suffering from can be seen as a gift of life,
it's
not a negative, right?
No, it doesn't have to be. No, it's an awakening. It's usually your first awakening. People that get really serious diagnoses, all of the great teachers that I've encountered recently say that. I was diagnosed with X, and that's when it began. My journey into myself, into healing, into a deeper understanding of causation. And, yeah, exactly. It's really important. I just want to say one thing to folks too, because I hear this a lot. They say, oh, I finally decided to get fertility massage or whatever. And then I conceived naturally after. So why didn't I do that 10 years ago when I started this? And I always tell them, no, it wasn't that one thing that allowed the scales to tip. It was everything leading up to that. Because people often think, oh, I've been wasting my time doing X, Y, and Z, and then I did this and it worked. No. Everything you're doing every day is helping you. It is preparing the terrain. It is getting you ready so that when you do the one thing, it does allow things to shift, but you prepared the journey. You prepared yourself for that one thing.
It's everything happens the way it's meant to be and our judgment of it. So I met a good friend years ago, Craig Humphrey, and I was going through some challenging emotional and personal problems. And he taught me about Buddhism and the philosophy of Buddhism. And I began to read a lot of that. And another friend of mine took me to meet Jack Canfield. I learned about The Secret, and I learned about Christianity from other friends, and just delve into all of the Islam and Judaism and Buddhism and Hinduism and all these things, and learned about our ancient beliefs in humanity and how powerful they are to our health and wellness. And the mind is ultimately the most amazing master of it all. Craig died of esophageal cancer. My good friend Dave died of lymphoma. And I can tell you, in their path on that journey, I only was taught how the higher power of all of us is always there with us. And God is the most critical concept and idea that we must embrace. And whatever you think of the thing that we call God, and there's a really good book called The Three Magic Words by U.S. Anderson that basically, we're it. We're it.
Yeah, yes.
And so I control my inner and outer worlds. I control the feelings within, right? And so, but it's hard for us to get that because our brain thinks it's all out there. And that's why when you finally did that massage and it was like it worked, well, all the things that you'd been doing along the journey conspired to you, for you, in you, that was the moment it was meant to be.
Mm-hmm.
It wasn't meant to be another moment. It was
Yes.
meant to be
Yes.
now.
Yeah.
Right?
Yeah. That's good. That's exactly right. I totally believe that. Yeah. Yes, I do believe our mind is our most powerful ally, and it's recruiting it to become an ally so that we are able to control. It's the only thing we can control is our thoughts. There's nothing else we can control. So we should focus on that which we can control, which is our thoughts. I don't know about our feelings. It depends on the day, but we can certainly manage them.
Well, that alligator reptilian brain and our feelings is the part that our thoughts are kind of the conscious thing, and the subconscious part, which contains all of that fight or flight, that instinctual thing, which it takes an immense amount of practice and work to hone the beast. Because I know even today, I get like, whoo,
I know.
I'm like, where'd that guy come from?
I know.
And it really is, oh my God, please forgive me. I'm sorry. Thank you. Ho'oponopono, Hu Lin, where it's as simple as thank you, I'm sorry, please forgive me. Those little things in life, and how we're learning from the ancient and modern, like sages of humanity, to teach us a way. And that's one of the things that I've always loved about Eastern medicine, because the Tao Te Ching and how we just keep going back, but somehow the thought creates the thing. But yet we learn about the thoughts and how we can change our thoughts, and yet somehow the alligator, the crocodile, the snake, right, comes out, and the devil just becomes the primary source. And so I mean,
it never ends. The triggers, it never ends. No matter how long you've been practicing, and it is a practice, you just get deeper and deeper and deeper into the original wound, the original triggers, and it goes way back. We don't know what's from this lifetime, other lifetimes, who knows? But all we can do is keep going, working with the triggers until we have no more triggers.
So I'm here today live on YouTube and Facebook with Jennifer Waters, acupuncturist and a traditional Chinese medical expert, also an expert in light therapy and photomodulation. I've respected her, worked with her for years. I'm on Instagram, but Instagram can only hear her, I think. If you want to see, you got to come over to the other side. And we're all working to come to the other side, I know, in all this. And let's see, how can they find you, Jennifer, both in person and virtual?
Well, in person is easy because I'm part of the CNY Fertility Complex, 191 Intrepid Lane, which, by the way, I'd like to just point out one thing that I really have become aware of with our location in Central New York, which is, Syracuse is the birthplace of democracy. This is where the Onondaga Nation is. And our location on Intrepid Lane, I really think it is sacred land. We are at the top of the hill. The valley is the nation. This is and this is the Onondaga Valley. The Onondaga Creek is there, and we are at the top. And I think it's a very powerful place in Syracuse, if not the most powerful place in this whole area, is where we are. And I feel the energy there really supports people to change. And it's like we are creating a vortex. There's so many people driving here, flying here, walking here, getting here. And we have this opportunity to come together and create some real positive change. And it's very tangible. And everybody says the same thing when they arrive. They feel so much better the minute they walk through the doors. And so I work every day when I'm driving to work. I think of that, raising the vibration, starting with myself and bringing the energy there to this sacred place.
And all of these accidents are not accidents. They're the universe conspiring in our favor. And we're in an ancestral cocoon location, which
Mhm.
is it's a healing energy. And
It is.
the place I'm in is sort of this energy that brought this kid from L.A. To this place in upstate New
Yeah.
York, and somehow
Yeah.
seeing people from all over the country and the world, but now setting up in places in Colorado and Sarasota and Montreal, working on L.A. and seeing people from all over the world, that we're really a leader in CNY fertility and healing arts in integrating all these concepts. And COVID's kind of pulled us back a lot, but we're really actually opening to re-blossom, to
Yeah.
rebrand, of
Yeah.
the sense that our healing arts centers are there, our acupuncturists, some massage therapists are there, photo light therapists are really there. And so much of what we're doing now is doing this virtually, that you don't have to come and physically see us. We
Oh.
can, and this is where that prayer and meditation to me are the most important things we can do. When I take my nap, by the way, I'm doing my meditation and prayer for 5 to 15 minutes, 3 times a day. And depending on your religion, we all should be doing that. That's the part that is so important for every one of us. We need to take responsibility to focus on this, less on putting things in here. And I've gone to the one time a day. I drink a little bit of coffee, a little bit of tea and water, but I think the snacking is really bad.
Yeah.
Fasting is lasting. And I think we can modify our lifespan, by the way, by reducing glycation, that reducing the inflammation. There are blue zones in the world, which people live a more, I don't like the term balanced life personally. I always say you have to be on one side or the another. You can't be on the fence and go back and forth. You have to either decide that this is the lifestyle I am going to live. But if you go to the amusement park too often, it's not good.
Right.
We are
Right.
really living in the temple. And
Right. Yeah.
maybe the center is the temple. And okay, well, that's the razor's edge, right? But if you venture either side too much, the crocodiles will take you down. I think that's something like that.
Yeah.
But,
Yeah. Sometimes we have to be extreme to do extreme things, like create health in an imbalanced situation. We have to go to the extreme. So it's not always about the middle way, but it's returning to the middle way. I totally agree.
with and what is an extreme? I guess that's all variable to different people, right?
Right. Right. Yes.
It's I always say anyone can do easy. It takes a special person like yourself, and when I say yourself, I'm talking to all of us out there.
Right.
Each and every one of us is a special person that is capable of everything and anything.
Yes.
And we are the most expensive, valuable, irreplaceable entities of the universe, the miracle machines. Why wouldn't you put the very best in here and the very best here? And so we are part of the family, and Vanessa and others talk about how we can inspire others and bring our family, our tribe together. We're best as small bands of tribes.
Yeah,
And
I like that. Yeah, that's good.
Even though we live in cities of millions, we want to imagine our tribal nature, our family nature, our pride, right? The lioness and the lion are in a pride. And the more we hold up each and every one of our family members, whether they're strangers or not, that's where we can take our health and wellness to the next level. That's the part that we need to do a better job at every single day. And the things I think we've been sharing at CNY Fertility, CNY Healing Arts, is ways of emulating that. And now that we have a globe of Zooming and virtual,
Mm-hmm.
we can do that a lot better.
Mm-hmm. Mm-hmm. Definitely. Yeah. 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 I totally agree.
What's your website personally, Jennifer?
It's jenniferwaters.net.
And we can find you there to learn more about photomodulation, light therapy, acupuncture, uh, traditional Chinese medicine, methods, modalities, and healing ideas.
Yeah, definitely. Also the fertile spirit.
But
So I created 2 programs with the fertile spirit. And one is to prevent miscarriage, prevent recurring pregnancy loss, which I'm very excited about this because so many women, couples are struggling with this. And just really quickly, there's 3 causes of miscarriage from traditional Chinese medicine point of view. One is excess heat. So we work together to clear out the excess heat, which is inflammation in the body. The other is stasis, that irritability, that blood stasis, that PMS kind of feeling. And the other is deficiency, back pain, knee pain, loose stools. So we really try to figure out which are you of the 3 and create a protocol to prevent that. And I feel very enthusiastic about how effective this is. And it doesn't have to take a lot of time. So the fertile spirit.
So the fertile spirit, people can go to thefertilespirit.com. They can find it on CMY Fertility.
Yes.
We make sure we have links on your website.
Yes.
If people are interested in the photo modulation, they would get a consultation with you.
Yes, that's it. Yep. Mm-hmm. Yeah. 30-minute consultation. We put together your diagnosis and then you start on a 30-day protocol.
And that can be very, very helpful for those that are suffering. Do you do any yoga practices or anything else, meditative practices that you can share with others and how that can be helpful?
I do. Although, it's funny. I don't use the word meditation anymore. I think it's lofty. People get intimidated by it. They think that they have to sit there and not think if they're meditating. So I think of it as observation. I do observation practice. Sit down, set the timer, 10 minutes, 20 minutes, watch your mind. You have to watch it, I think, for a couple decades before you can start concentrating. After you observe your mind for a long time, then you can really start concentrating it. So that is my practice. I'm very humbled by it. I've learned a lot. I've had very good teachers along the way. It is a ceremony. We are creating sacred space, just like you said, in your own mind, your heart, your space. We're all spending more time inside in our homes, which is wonderful. Let's make it beautiful. Let's clear out all the negativity, clear out the stuff that's not serving us so we can raise our vibration up. I try to do that every day.
Let's see. Jay Lynn asked a little bit about recurrent pregnancy loss and whether or not let me just bring this down on her. Do you recommend your services while going through fertility treatments or when pregnant?
We adapt the program for wherever you're at. This is the cool thing about true healthcare, alternative, complementary, whatever you want to call it, is that we customize it for you where you are at today. So when we are creating an endogenous experience in the body, there's less risk than taking supplements because we're bringing your body back to balance. It knows exactly how many stem cells to make. It's not like saying you're taking 4 pills 3 times a day. So it's part of why I really like working with light, because the risk is lower and your body is creating it. So it's more successful, I feel, than introducing external substances, if that makes any sense.
Well, and one of the things I recommend is, and I do guided meditation. So and for me, it's always create the thoughts, the gratitude, which is the way to create the vibration of calming the body through thoughts in the mind. For me, meditation isn't clearing the mind, it's guiding the mind. And that's so critical, I think, in getting to where you want to be. I am having a baby. I am healthy and well. I am living an awesome, amazing life. I'm grateful I go down the list of all the people in my life and all the things, even the things that have been heartaches and hard and challenging and worrisome and fearful. I'm always find gratitude within all of that. And the things that I think are important is, I think acupuncture, continue that throughout, whether when you get pregnant, you want to stay pregnant, and
Yes.
the yoga, the meditation guided, keto to me is like food. You want to eliminate those toxins that are causing the problem. You want to fasting throughout pregnancy is the most amazing thing you can do.
That's a good stress.
That is
the beneficial stress. Yeah.
Correct. And although, I mean, it's sustenance. Maybe we change it's the sustenance that the body requires, but ultimately that's the real important part that we put together between our healing arts and our fertility and what you've brought to the table here, working with Donald Clark, with Muha, and Heather, and many other practitioners. But I'm so grateful. We're about an hour, and I'm so grateful for the time you've given us today. And you can get the chance to see Jennifer in our 191, 195 Intrepid Lane in Syracuse, online. I think we need to add a retreat coming up, a live Zoom retreat, to bring our other practitioners and just to have a nice few hour or day long retreat to talk more about these things, to interact with our clients, to get a better understanding of what they're feeling and suffering from, and how we can better help them. Did you have any just last minute thoughts, Jennifer?
No. Thank you for this opportunity, Dr. Kiltz. Thank you for everything. I appreciate it. It is an honor to serve, and I feel very lucky to be here. And
I feel very blessed and lucky too. I'm sure I'll see you this week. And everyone, gratitude, and keep on sharing the stories of love and faith and healing. And I am healthy. Take care.
Okay.